Rheumatoid arthritis is a long-term disease that leads to inflammation of the joints and surrounding tissues. It can also affect other organs, making the damage it can cause, if left untreated, all the more severe. Here's Dr. Dina Dell with a comprehensive look at this autoimmune disease.
Imagine a pain that never goes away.
All of a sudden you're so stiff you can't move.
It's a disease that attacks both young
I can't remember a day that I don't hurt.
and old.
I couldn't get up in the mornings. I just couldn't function.
For 1.3 million people, this is reality. And for 30-year-old Robin Nichols, the pain started at just 2.5 years old.
These are just the prescriptions I take here. Kind of threw all them together.
Over the years, it's gotten progressively worse.
I'm terrified of falling, tripping and falling, because I'll just shatter.
It can strike at any time, in many different ways. But for most people, the pain begins in their 40s, 50s, or 60s.
The onset of rheumatoid arthritis can be explosive. People can go to bed feeling well one night and the next morning develop symptoms that are fairly dramatic, or it can be very insidious, very gradual. It just varies from person to person.
Rheumatoid arthritis, or RA, happens when the body's own immune cells attacks the body's own healthy tissues. 50-year-old Kathy Abernathy first noticed her knees swelling, and now
I can't make a fist anymore.
Kathy is not alone. According to the Centers for Disease Control, 75% of patients are women. Why it strikes one and not the other, nobody knows. What we do know is that the two main causes are genetic and environmental. Another possible trigger is preventable.
Smoking, believe it or not, is actually a risk factor for the development of rheumatoid arthritis.
Symptoms include joint pain, swelling, stiffness, restricted range of motion, and extreme fatigue. For many, it's a constant way of life.
Today, it is a finger that doesn't want to straighten.
Linda Lance takes rheumatoid arthritis in stride.
It's, just an ever-changing disease, and you just have to be very agreeable to, the change and try to focus on what you still can do and not what you've lost.
Attacking RA before symptoms appear or at the first sign gives doctors and patients a better chance of stopping its progression. Medication runs from pills to shots to infusions and even chemo-type therapy.
Most medications are either symptom reduction or actually prevention of progression of disease, but there's no cure yet.
The medications we use to treat rheumatoid arthritis often very potently suppress the immune system.
I can't be around anybody that has the slightest germs or sickness because I have zero immunity. From being on all my immunosuppressant meds, I catch everything.
Treatment includes biologics, steroids, anti-inflammatories, painkillers, and joint replacement surgery. Robin had both her knees replaced, and even though her ankles are fused, it doesn't stop her or the others from enjoying the good things in life.
I think of myself as very capable of doing a lot of things just in a different way.
Helping them live a more normal life now until a more permanent solution is found.
I wish they'd find a cure for arthritis in my lifetime. That's what I always say, and that would be fantastic.
Until then, there's new hope, new medication, and new therapies to help relieve the pain. I'm Dr. Dina Dell reporting.
Present treatment strategies, including pain relief, as well as other medications, a balance between rest and exercise, and patient education can really improve a patient's prognosis. I'm Elizabeth Danheim.